Hello everyone, my name is Maureen Okereke, a doctoral student of Bradman University. I currently work at Telemetry Unit Southern California Hospital in Culver City and as a family nurse practitioner at AIDS Healthcare Foundation. I'm here to present my stakeholder educational plan video. Also in this video, I'll also be talking about my scholarly project. So my scholarly project is among hospitalized ill patients, does the use of antimicrobial peripheral inserted central catheter versus non-microbial decrease the incidence of peak-associated bloodstream infection over a period of 3 months? In this presentation, I will discuss the stakeholder groups, each group role in the project implementation, the theoretical foundation and conceptual framework underlying the proposed intervention, educational needs of each group, and an outline plan for delivering the intervention. Overview of the problem. Central line associated bloodstream infection are the third most frequent cause of healthcare associated infection. Mortality and morbidity rates from Class B are 12 to 25%. Many as 28,000 patients die from CLABSI annually in the United States, and the cost of CLABSI per episode of care ranges from $3,700 to $36,000, and hospital length of stay. CLABSI can destroy a hospital reputation and financial stability. The Center of Medicare and Medicaid Services deny hospital payment costs associated with CLABSI and report cases of CLABSI on its website. National initiatives to prevent CLABSI includes efforts from Department of Health and Human Services, the Institute of Medicine, the Institute of Healthcare Improvement, and Center for Medicaid and Medicare, has led to substantial decrease in CLABSI. Central lines are often used in ICU setting. The increased use of peripheral inserted catheters in non-ICU setting and recognition of CLABSI in non-ICU setting has led to new efforts to understand the best way to prevent CLABSI. The adoption and implementation of evidence-based practices has been associated with 46% reduction rate in CLABSI. Lower rates of CLABSI are achievable. However, maintaining zero CLABSI rate continues to be challenging. Further efforts are needed to prevent harm in both settings. Stakeholder groups and role in project implementation. The aim is to get potential stakeholders in the administrative and clinical field to achieve a goal of zero CLABSI events for a sustained period. Several stakeholders will be involved in the evidence-based project. This will include the Assistant Chief Nursing Officer, my unit director, unit manager, charge nurse, infection control specialist, computer information technologists, providers including physicians, nurse practitioners, and PAs, patients and families, infection control specialists. I chose these stakeholders for my scholarly project because they will play an essential role in implementing and complying with evidence-based initiatives that have the potential to decrease CLABSI. Secondly, they will assist in the implementation process and monitor progress in achieving goals and share outcome data regularly with each unit. The Assistant CNO will assist in the acquisition of resources to support the implementation of the project and has enough authority to assist when barriers arise. The infection control specialist will review infection risk, conduct rounds, provide education and training, and enforce implementation of evidence-based infection control strategies and enforce policies. The computer information technologist will oversee the IT unit of the hospital. He will integrate the electronic communication at all levels, address technical issues, its usability, networking, security issues, and extend real-time communication of health informatics among health professionals. The other stakeholders, who are the registered nurses, MDs, MPs, and PAs, and nurses are on the forefront of patient care and responsible for ensuring that appropriate infection preventive practices and evidence-based practices are always used, and will be part of educational and special sessions that will be conducted before implementation of the evidence-based project. Patients and families are the population who require a central line insertion and treatment. They will be provided with education materials and be educated on the preventive practices. Theoretical foundation and conceptual framework. The change theory will guide my project theory and serve as a testimony to the fact that change is a real phenomenon. Theory of change describes the effectiveness with which organizations are able to modify their strategies, processes, and structures. It illustrates that a successful change consists of three stages: unfreezing or activating change, transition stage where change occurs, and freezing or stabilizing change. I chose this change model because it simplifies a complicated process and enables people to understand the stages of change, which is categorized to the theory in question. There is no right or wrong answer when leveraging a change management model. Knowing it's your motivation that inspires the strategy, what is most important is the change process has to be implemented step by step without overwhelming the individual in order to achieve sustained success. My conceptual framework model will be the PDSA model. This model is a useful tool for documenting a test of change. The PDSA circle is shorthand for testing a change by developing a plan to test the change, carrying out the test, observing and learning from the consequences, and determining what modifications should be made to test the act. At the heart of PDSA circle is the ability to break things down and focus on making small measurable changes, and it is commonly used improvement process in healthcare settings. This model can be applied to management of any process. Educational needs for each group. The educational needs for the assistant CNO and unit director will be on the goals of the project. They will communicate the vision to the staffs, provide human and physical resources, tools, and support for the project implementation. They work with staffs to overcome barriers and performance monitoring. The educational needs of the physicians, MP, and PAs will be to undertake the purpose of the project: risk assessment and determination, application of evidence-based screening tools as they will be involved directly with patient care, and in the implementation, addressing peak care policy using antimicrobial solution logs at the time of insertion and scheduled dressing changes. They will be part of educational and special sessions that will be conducted before implementation of the evidence-based guidelines. The educational needs for the unit manager, charge nurse, registered nurses, and infection prevention specialists will be an overview of CVC and PICS, insertion guidelines, identification of CLABSI, review of new policy and protocol that will be implemented. The educational needs for the computer information technologies will include purpose of the project, electronic data management and implementation. The educational needs of the patients and families will be the purpose of the project and awareness of current policy in place and regularly scheduled dressing changes. Plan for delivering the intervention. The planning phases entails assessing the needs for the project by developing the PICO question or statement, and conduction of extensive literature review, which covers the use of mobile and smartphone technology in the prevention of CLABSI, use of antimicrobial log solution, adherence to best evidence-based practices, infection prevention, and synthesizes all the information. The second phase involves developing the implementation plan, identifying the project goals, stakeholders groups, the project needs, mind maps, educational programs for clinicians, regular feedback of data summarizing direct observation of catheter dressing. During the during this stage, there will be multidisciplinary rounds, staff education, reminders, regularly team meetings, and daily goal setting to achieve the goal of CLABSI reduction for a sustainable time. Sustainability can be achieved by repetitive summary of CLABSI guidelines, daily goal checklist, using printed educational materials, and encouraging staff to voice safety issues and to act quickly to address them. The stakeholders will be updated about the status of the project through meetings that will take place twice a month and will be open to their opinions, questions, and suggestions. Thanks for listening to my stakeholder education plan video. References will be attached on this video. Thank you.